Hi everyone. So now we will see about pathogenesis of atherosclerosis. So I have made some diagrams to explain. So first I will explain the diagrams with labeling, and then I will explain the pathogenesis so that you can understand better. So first, this is a cross section of normal vessel. I will explain this. This outer line will be resembling tunica externa, and this middle one will be tunica media, and this is tunica intima, and this one is endothelium. And in this diagram you can see these are monocytes and this green one are platelets, and in tunica intima you can see yellow color, so this will resemble the lipoproteins or lipids. In this diagram these are smooth muscle cells coming from tunica media into the tunica intima, from lumen to intima. And in this you can see these are actually macrophages, which monocytes will get activated and turned into macrophages. So macrophages will engulf the lipid which ever is present within the tunica intima. So now you can see all of the lipid is present inside the macrophages. So this one, macrophage with lipid, is called as foam cell. So smooth muscle cells will also engulf the lipid. So as atherosclerosis is an inflammatory process, so immune system gets activated and we can see T lymphocytes here. So this is a fatty streak which is manifested within the lumen of the vessel, and at last it is a perfect atherosclerotic plaque. So you can see fibrous cap here, and this is the necrotic center, and these are foam cells and lymphocyte. So this is a fibrofatty atheroma which will nearly occlude the lumen of the vessel. So now we will go for pathogenesis clearly. So first, this is a normal vessel. So this is a normal vessel when it will expose it to any of the risk factors like hyperlipidemia, hypertension, smoking, toxins, viruses, hemodynamic factors, inflammation. So it will get chronic injury and there will be dysfunction within the endothelium. So among all this, hyperlipidemia, hemodynamic factors, inflammation are more majority chronic injury causing risk factors. So as a response to the endothelium injury, now monocytes will adhere to the endothelium and they will enter the tunica intima, and then they will get transformed into macrophages, and platelets also adhere to the endothelium. So now in this you can see macrophages are activated and they are engulfing the lipid, and as a result foam cells are formed. So this adhered platelets and macrophages will release some factors which will cause smooth muscle cell recruitment into the tunica intima, either from the lumen or from the tunica media. Now smooth muscle cells are present in the tunica intima and they are also engulf the lipid, and as it is a long process, so you can see fatty streaks are nothing but the streaks means lines, right? So fatty lines which are seen from the lumen. So at last smooth muscle cells will form a fibrous cap outer to the necrotic center. So they will form the extracellular matrix which will consist of collagen, elastin, proteoglycans, which will stabilize this atheromatous plaque. So at the junction of smooth muscle cell fibrous cap and tunica intima, we can also see neovascularization, and mostly inflammatory cells and macrophages are present at this junction, and in the core only lipid and cholesterol are deposited. So this is the pathogenesis. Now we will just overview this. So first, endothelial injury and dysfunction, and it leads to accumulation of lipoproteins through the abraded epithelium. Then monocyte addition to the endothelium and emigration of monocytes into the tunica intima, and they will transform into macrophages. Now the platelets which have adhered to endothelium will release some factors which will activate the smooth muscle cell proliferation and their recruitment into tunica media. And smooth muscle cells in the tunica media will form extracellular matrix, stabilizing the plaque. And so T cells will come as an immunity process. So further lipid accumulation will be there, and after a prolonged time, calcification of extracellular matrix and necrotic debris will occur. So this is the pathogenesis of atherosclerosis. Thank you.